My name is Michael Judd, and I'm a hobby woodworker. One Saturday early last year, I began building a set of chest of drawers for my granddaughters. In cross-cutting, the wood slipped, and my hand traveled across the spinning blade of the table saw. A serious injury resulted. My thumb was damaged. My palm was cut, and all 4 fingers were cut. I went to a local hospital, and then was sent on to Salt Lake City, where we eventually were told they just couldn't get to us, but that if we would call back in a couple of days, they would see if they could take care of us within the next 2 weeks. We made a quick call to AOS, and the surgery was done the next day. Everything that was done was very professional. The reason we appreciated AOS so much is that each time we went for a checkup, everyone greeted us warmly, and we felt like they really cared about us. They really cared about my hand and its recovery.
From routine tasks to the simple human touch of a handshake, hands are integral to every aspect of living. Taking an orthopedic approach to hand treatment involves thorough and extensive training. The expert physicians at Alpine Orthopaedic Specialists have pursued this training to provide the best possible hand, wrist, and elbow treatment and care. It's part of the AOS 360-degree healing philosophy. Using the leading diagnostic techniques to assess the condition of muscles, nerves, bones, and joints in the hand, wrist, arm, and elbow, the specialists at AOS can treat a full range of ailments, conditions, and injuries.
The hand is such a visible part of people's lives, and it impacts everything you do. And while we want to make your hand look good, the most important thing is really how it functions. So you have to look at function as well as form.
Hand, wrist, and elbow specialties at AOS include joint fusion and replacement, reconstruction of simple and complex fractures, treatment of arthritis, carpal tunnel treatment, and complex tumor resection and reconstruction. Whenever possible, the surgeons at AOS use minimally invasive surgical techniques such as arthroscopy and endoscopy, which use fiber optic lenses and cameras to delicately work through tiny incisions.
We use endoscopic techniques because, generally speaking, the patient has a much faster recovery and recuperation. And when you're talking to patients, especially here in Utah, their #1 goal is to get better as rapidly as possible.
Surgeons at AOS perform arthroscopic and endoscopic surgeries daily and are experienced with the best techniques and equipment. Dr. Miller alone has performed over 3,000 endoscopic carpal tunnel release procedures in his career.
Once you make a decision, whether it's operative or non-operative, then it's my job to coach them to say, okay, you're at a normal position, you're progressing normally, and the physician owes it to the patient to be able to guide them down that road, and that's why I see my role basically as a coach to help those patients down that road.
I am back to building that same chest of drawers now, thanks to the good people at AOS.